Hi, this is Janet Fantasia, and this week we are going over our COPD readmission reduction program. And this is actually a program I was working on in April of 2014, and it's still very applicable to what is going on right now. So overview, COPD is the third leading cause of death in the United States, and this has been published and true according to the American Lung Association of August 2013. And the CMS also concluded that COPD is a leading cause of mortality worldwide. There are 12 million people diagnosed with COPD, and there's another 12 million people that don't even know that they have it yet. And in 2010, the U.S. spent over $29.5 billion in direct healthcare expenditures with additional costs not captured in claims due to underdiagnosed and misdiagnosed patients. And according to the American Association of Respiratory Care, actually $49.9 billion was spent on COPD in 2014. So you can see this rise keeps, the costs keep rising. And among all disease states, COPD patients have the highest readmission rates in the nation. So it is the third leading cause of death in the United States. The number one cause is heart disease. The number two cause is cancer. And number three is COPD. And number four is strokes. And as you can see by this picture, that over the years, the number of COPD deaths in women has increased sharply, and it's plateaued for men. So you can see on the graph that we're approaching 80,000 in the year 2009, and it just continues to grow. So the problem is that other diseases, such as coronary heart disease, stroke, other coronary vascular diseases, and all causes of death have gone down over the years, but COPD, this is the one that keeps on climbing, and it shows that it has increased from 1965 to 1998 by actually 163%. So this is a grand problem that we have here. And CMS has said, yes, this is a problem and associates with mortality and readmission. And so they developed a hospital outcome measures to assess our 30-day mortality and readmission rates. And they have put in some fines and some holding hospitals accountable for their readmissions, which has been about 18% over the years. So CMS plans to publicly report these measures of hospital comparing. And they started doing this in 2014 as part of a hospital inpatient quality reporting program. And additionally, CMS plans to include the COPD readmission measure in the fiscal year of 2015, so it happened this year, and hospital readmission reduction program, which is HRRP. Mortality and readmission rates for patients with COPD vary widely by hospitals, suggesting that opportunities exist for hospitals to improve in the quality of care provided to our COPD patients. So lastly, I just want to share with you the AARC Times article in 2014, which was titled "Readmission is a Failed Transition," and the community issues include failure of communication between hospital and the community. So this is huge what they have identified, that really our planning and our processes need to encompass both the acute care hospital and the community. And I love this quote. So, no quarterback, however skillful, can completely pass without downfield receivers with whom he has trained, and no receiver can catch a pass from a quarterback who does not know how and when to throw the ball. Patients are not footballs, but teamwork is teamwork. So the next part of this assignment is I want you to read the full AARC Times article, and we will have a discussion, posting a discussion to your classmates, 150 to 300 words, and you will reply to 2 of your classmates in at least 75 to 150 words. I look forward to reading your replies because this is a very exciting subject and a very important one too. Thank you so much for your time and listening to this presentation.